Welcome back, our fans. General anesthesia. Definition. General anesthesia. A medically controlled state of unconsciousness accompanied by a loss of protective reflexes, including the inability to maintain a patent airway independently and respond to physical stimulation or verbal command. Objectives of GA. Provide safe, efficient, and effective dental care. Eliminate anxiety. Reduce untoward movement and reaction to dental treatment. Aid in treatment of the mentally, physically, or medically compromised patient. Eliminate the patient's pain response. Indications of general anesthesia in pediatric dentistry. Patients unable to cooperate with certain physical, mental, or medically compromising disability. The extremely uncooperative, fearful, anxious, physically resistant, or uncommunicative child. Patients with dental restorative or surgical needs for whom local anesthesia is ineffective. Acute infections, allergy, anatomic variations. Patients with extensive orofacial and dental trauma. Patients requiring immediate comprehensive oral and dental needs. Patients requiring dental care for whom the use of general anesthesia may protect the developing psyche and/or reduce medical risks. Contraindications. Patient refusal. Lack of adequate doctor training/equipment. No recovery area. No anesthesia team. Medical contraindication. Advantages. All required treatments are performed in a single session in a hospital environment, providing efficient services in a safe mode. Facilitated dental treatment and increases the access to dental care, especially for medically compromised patients, very young patients, patients with a high degree of dental fear or anxiety. Allows dentists to provide a higher quality of care, providing an opportunity for parent and child education on positive oral health behaviors, which can lead to positive behavioral changes and improved oral health. Disadvantages. All anesthetic agents are associated with some hazard and risk to patients' overall health, with some reports of morbidity and mortality. Injuries to tooth, lip, and other soft tissues occurs during laryngoscopy and endotracheal intubation. The other reason is the incorrect or forceful use of mouth openers. Expensive and need training. Complications. Sore throat, nausea and vomiting, damage to teeth, lacerations, cuts, to the lips, tongue, gums, throat. Awareness under anesthesia. Anaphylaxis or allergic reaction. Respiratory complications, aspiration, hypoventilation. Cardiovascular complications, hypertension or hypotension, cardiac arrest. Pre-anesthetic preparation. The patient and the parent are to be explained about the anesthetic and dental procedure, and the following dietary instructions are to be given. Clear fluids such as water, juices without pulp, carbonated beverages are allowed up to 2 hours preoperatively. Breast milk up to 4 hours preoperatively. Infant formula up to 6 hours prior to the procedure. Non-human milk up to 6 hours before the procedure. A light meal up to 6 hours before the procedure. NPO status. NPO means nothing by mouth, period of time in which you may not eat or drink anything. Solid food 8 hours. Liquid 4 hours. Clear water 2 hours before induction. Pediatric stop breast milk feeding 4 hours. The reasons for these recommendations are 1. Emesis during or immediately after the sedative procedure can result in aspiration of the stomach contents, leading to laryngospasm or severe airway obstruction. 2. As the sedative agents are administered by the oral route, drug uptake is maximized when the stomach is empty. A proper consent should always be taken. The patient must be accompanied before and after the surgery and supervised by an adult for 24 hours. Anesthesia events practically. 1. Induction. It is the period of time which begins with the administration of an anesthetic up to the development of surgical anesthesia done by inducing agents sevoflurane, halothane, isoflurane. 2. Maintenance. Sustaining the state of anesthesia done by inhalation agents nitrous oxide and halogenated hydrocarbons. 3. Recovery anesthetic stopped at the end of surgical procedure. And consciousness regains. Recovery. Initially, patients are best nursed in left lateral position with a degree of head down tilt to encourage drainage of any blood and secretions away from the larynx and administered 100 oxygen thorough but gentle oropharyngeal. The patients are monitored in the recovery area for at least 30 minutes. No oral fluids are given for 1-2 hours to avoid vomiting and aspiration. Postoperative analgesia. The main problem is the psychological trauma of waking up uncomfortable in a strange place. It is important that the parents are present, and the administration of paracetamol 10-15 mg kg is usually all that is needed. Analgesia may be given rectally, paracetamol or diclofenac suppositories, during the operation. Ibuprofen or paracetamol may be given orally in liquid form in recovery. Postoperative instructions. 1. Monitor child throughout the day following surgery. 2. Do not allow child to return to school or attend activities following the surgery. 3. Please assist child with walking to the car and to the bathroom. 4. It is important that drink liquids throughout the day. Do not encourage eating too soon because your child's stomach may be upset. 5. You may give ibuprofen every 4-6 hours if needed to reduce the soreness, discomfort, and possible swelling following the treatment. 6. If the child had local anesthetic, numbing, then the child has to be closely watched to prevent him/her from sucking, pinching, or biting his/her lips, cheeks, and tongue. Postoperative instructions. Brushing has to begin the night of the surgery. A wet washcloth may be used instead of a toothbrush to wipe the teeth and gums. Stainless steel crowns, gums, oral hygiene measures. Avoid sticky foods until the crowns fall out. Composite fillings or sealants placed, avoid sticky foods and candy, because the fillings can pop out. Tooth colored crowns placed on front teeth they cannot bite on with their front teeth will need to cut these types of foods and chew them with posterior teeth. With extraction, it is important to avoid spitting plus avoid eating hot food. Avoid a lip biting, avoid a toothbrushing this day, disturbing the wound if the area begins to bleed again. Bite down on gauze for 15-20 minutes and the pressure will stop the bleeding. Patient discharge. Airway patency is uncompromised. Cardiovascular function is satisfactory and stable. State of hydration to be adequate. Patient should start clear fluids. Patient should be able to talk if applicable. Patient should be able to sit if applicable. If the patient is very young or disabled, the pre-sedation level of responsiveness or the level as close as possible for that child is to be achieved. Responsible individual adult is available. Thanks for watching. Support us by likes and subscribes.